Morning everyone. Today I'm going to discuss on the topic of anaphylactic shock. Rather, I would like to give you a bird's eye view on the topic of anaphylactic shock. Shock is a state of circulatory inadequacy with overperfusion to tissues resulting in generalized hypoxia. Shock is a condition which means that there is reduced oxygen supply when there is high oxygen demand, leading to ischemia to the tissues. Because when there is too high oxygen demand and delivery of the oxygen is low, then there will be because of reduced oxygen delivery, the tissue will undergo ischemia. That will lead to cell death, tissue death, and if not treated appropriately in appropriate time, then it may lead to the death of the person. It is a condition which is very common in pediatric population and has high morbidity and mortality. It is defined as impaired perfusion with too high oxygen demand in comparison to oxygen delivery. Life-threatening situation due to poor tissue perfusion with impaired cellular metabolism, manifested in turn by serious pathophysiological abnormalities. This definition was given by Bailey and Law. Similarly, Davidson also gave the definition of shock. He defined shock as the clinical syndrome that develops when there is critical impairment of tissue perfusion due to some form of acute circulatory failure. When a person undergoes shock, he represents many symptoms that can include anxiety, agitation, restlessness, bluish lips, chest pain, confusion, dizziness, lightheadedness, faintness, limbs become cool, clammy, paleness of the skin can be seen, low or no urine output, profuse sweating, moist skin, rapid but weak pulse, shallow breathing, unconsciousness or unresponsiveness. Important to know what is the normal heart rate, systolic blood pressure and respiratory rate when we want to know what is abnormal. So, as the age increases, the heart rate tends to decrease. As a neonate, the heart rate is high because the vagus has not developed. As the age increases, by the age of 6 to 8 years, the vagus has developed fully and the heart rate tends to become normal as that of an adult. In a neonate, the heart rate is about 100 to 160 beats per minute, and by the age of 12 years, it becomes normal like 60 to 100 beats per minute. Systolic blood pressure is low in case of neonate, and as the age increases, it increases and tend to become normal. Or as in level with that of the adult by the age of 12 years. Same goes with respiratory rate, as respiratory rate is also controlled by the vagus. That's why as the age increases and when the vagus start to develop and it get fully developed, the heart rate becomes normal, and in neonate the respiratory rate become normal. As in the neonate, respiratory rate is 30 to 60 breaths per minute, and when the age increases, like in a 12-year-old or more, the heart rate, the respiratory rate becomes normal as that of an adult, that is 12 to 15 breaths per minute. Now let's discuss about the pathophysiology of shock. When there is initial insult like an injury, then let's say just an injury, then it triggers shock, which is decreased perfusion to the body or body tissues, leading to body's compensatory mechanism. If the body's compensatory mechanism is effective enough to compensate the shock, then the normal sign and symptom can be seen in the person. But When the body fail to compensate the shock or the oxygen demand because of the insult, then the body gives rise to decompensated shock. If not treated, then it leads to multiple systemic failure and ultimately to the death of the person. Form of allergic reaction, and it is rapid and potentially fatal. While the prevalence of anaphylaxis is highest 2%, the fatality rate is extremely low, that is 0.5% case fatality rate in those hospitalized. Diagnosis and management are challenging because these are often immediate and unexpected type of shock. So let's just understand the pathophysiology of anaphylactic shock with an example of ragweed allergy. So when a person who is allergic to ragweed when first comes in contact with ragweed pollen, then the person does not feel any sign or symptom, but the person develops a large number of antibodies against the ragweed. These Ig molecules attach themselves to mast cells. So when the person comes in contact with ragweed for the second time, these uh, Ig uh, IgE molecules which are bound to mast cells, since they are bounded to mast cells in a very large number, so they tend to generate a very fast and immediate onset of reaction because of release of histamines and cytokine into the environment. These chemical mediators cause the characteristic symptoms of allergy or shock. Anaphylactic shock can be caused by many reasons. These can be food, medications, allergen immunotherapy, insects like bees or wasp sting, unidentified causes like idiopathic anaphylaxis. Less common causes can be exercise, natural rubber or latex, hormonal changes, topical medication like chlorhexidine, transfusions. There can be many symptoms for anaphylactic shock, but most common symptoms are hives, that is the production of rashes on the skin, itching, wheezing or shortness of breath, low blood pressure, pale skin color. Other common symptoms include upper respiratory congestion, runny tongue can be swollen, lips or throat become swollen. There will be difficulty in breathing, wheezing. A person can experience chest tightness because of these symptoms. Digestive system, nausea, vomiting, diarrhea. Nervous system includes anxiousness, confused. The person may have slurred speech. Some of the telltale signs of anaphylactic shock can be the person may not be able to speak more than 2 to 3 words as the tongue has become swollen, or the person is sitting straight up or with hands on knees because of chest tightness or because of ragged breathing or difficulty in breathing, and he may be gasping for breath, pursing lips to breathe, using neck muscles to take breaths. And these are the most common signs which can be seen in a patient of anaphylactic shock. Now, common diagnostic tests are skin tests like in vitro IgE test, which can determine the presence of specific IgE antibody in food or medication uh, and stinging insects. Clinical diagnosis of anaphylaxis can be supported by the documentation of elevated concentration of mast cells and basophil mediators like plasma histamine or serum or plasma total tryptase. There can be various types of allergy tests like skin scratch test, intradermal test, patch test, blood IgE test, challenge test. Now, challenge test. Now we have come to a most important aspect, clinical aspect. So first we will see how will we assess. First thing is ABCDE, that is airway, breathing, circulation, disability and exposure. First we need to check the airway if there is any kind of obstruction to the airway. Call for help immediately if there is any sign of obstruction. Breathing, look for and treat bronchospasm and signs of respiratory distress. And check for circulation, we need to check for normal blood pressure of the patient and pulse. Disability can be assessed by whether the person is responding or whether the person is conscious or not. Exposure, assess the skin with adequate exposure but avoid excess heat loss. Since the person is having breathlessness, restlessness and difficulty in breathing, then we can consider to open up a few buttons of the shirt of the person so that the person may be able to breathe properly and there will be no difficulty in respiration. But we should always avoid too much exposure as it will cause heat loss. Then management. In acute management, we first administer adrenaline in a amount of 0.5 mg or 0.01 mg per kg, and then we put the patient in Trendelenburg position, that is head tilt, head chin tilt and legs elevated. If intramuscular epinephrine fails, then we need to administer intravenous epinephrine. Vasopressors like dopamine can also be considered if epinephrine is not able to elevate the body hypotension. Following acute treatment, the patient should be observed for a period of time, and about 4 to 6 hours the patient should be kept in observation. These are the recommended doses of epinephrine according to. Since in any, especially in anaphylactic shock, the patient experience hypotension, then there is need to administer intravenous fluid. In adults, 500 ml of warm crystallized solution should be administered in 5 to 10 minutes if the patient is normotensive, or 1 liter if the patient is hypotensive. In children, 20 ml per kg of warm crystalline solution would be essential. When the patient is under observation, then the patient should be given oxygen, and the oxygen saturation should be maintained at the level of 94 to 98%. Back mask be used. In case of tracheal intubation, if equipment and expertise are available. Reassess the pulse rate and BP regularly every 5 minutes. And aim for normal blood pressure. In adults, systolic blood pressure should be more than 100 mmHg. In children 0 to 1 month, minimum should be 50 to 60 mmHg. For more than 1 to 12 months, the minimum blood pressure should be 70 mmHg. For more than 1 to 10 years, 70 plus age into years into 2 mmHg blood pressure should be maintained. And for the age more than 10 years, minimum blood pressure should be 90 mmHg for the patient. Now we have come to dental consideration. In case of anaphylactic shock during any dental procedure, then we have to immediately call for help and request for emergency drugs, oxygen and resuscitation kit, and assess the patient following the ABCD approach discussed previously. If anaphylaxis is suspected, ambulance should be called and state anaphylaxis, and the dental procedure should be stopped immediately. Airway should be cleaned. Remove any contact of triggering agent to the patient. Ensure the patient in a comfortable position. Administration of 15 liters per minute oxygen through a non-breather oxygen mask, if available, should be done. For severe reaction, if there is life-threatening situation, then airway or breathing or circulation problem, if observed, then administer IM adrenaline. Closely monitor the patient following the ABCD approach. Repeat intramuscular adrenaline at 5 minutes interval until there has been a adequate response. Do not sit the patient up or stand them up if they are feeling faint or dizzy, which can lead to profound shock. or in severe cases can lead to cardiac arrest. There has been many instances where